Okay, Renee, another form of cardio that you can do, especially at the gym, is on the cross trainer. It's a great, obviously, if you're injured and you can't be running, you can do this. But it also gives you an upper body workout with the arms as well. So basically, just hop into the foot pads. You can either hold on here for the upper body work, or you can just hold on to the arms here. And basically, like these big snowshoes, it's just a walking motion.
Yep. Start
off nice and slow. The controls on here, you can set the ramp at a different height level, so you can be like walking upstairs or up a hill. There's also resistance on the machine, so that it can make it harder with the magnetic belts in the back, makes it harder to take the steps. And then obviously you just build up to a speed that's comfortable for yourself. Holding onto the handles, as I said, gives your upper body a workout as well. So this thing machine has inbuilt programs which will automatically change the resistance levels and the height levels for you if you want to try that out at some point. And there's a built-in fan to keep you nice and cool.
Cool.
Just be careful stepping over.
Start that.
Yep. And just gently go the other way. Yep. So you're just stepping forwards.
Yep.
Nice and slow to start. You find this gives you a really good leg workout, glutes, hamstrings, quads, and your calves as well. And you'll find with the upper body, it's giving your arms, chest and shoulders a workout. So if you wanted to change the level, you can change the ramp. Feel a difference in that?
Yeah. Yep. That's good.
Obviously,
almost like skiing.
Very much like skiing. It's working similar muscles that you would be for running, but in a different way. So hence the name cross trainer. It's good whole body workout. Fantastic.
Good. I like this one.
Okay, now I'm just going to run through a little bit of a boxing circuit. Renee's done boxing before, so she's up to speed with the correct technique and how to use the pads and the gloves. So basically, we're just going to do some warm-up jabs, and then we'll get into some combinations. So we'll just go through with your jabs and crosses. Make sure you're punching through, not fully extended. You don't want to hyper-extend the elbows. Go through some combinations.
Yeah.
So now we're going to work through some combinations. So I want you to really concentrate on your stance. So with your back foot, just turn it down a little bit. That's it. To give you more stability. So now we're going to work through 2 jabs and a cross. We're going to go through that 10 times. So what I really want you to concentrate on is with your cross, using through your hip. You get more power through your hip. It's not just about your arm. That way you might have to worry about hyperextending your elbow as well. Okay, so remember jab, jab, cross, and we'll go through 10 times. That's it. See the power, coming through your cross, using your hip. 2 more. Okay, now we're going to add in an uppercut. So you're going to jab, jab, cross, uppercut. Okay, still concentrate on your stance and using your hips. Let's go. I'm trying to speed it up a bit more. That's it. added some variation. You could do this in Tabata, which is a high intensity interval training. You work flat out for 20 seconds, 10 seconds rest. You do that 8 times, and you can change that up with a multiple number of combinations or exercises, etc., just to give you that higher intensity exercise and better calorie burn. It's good for cardio.
That's good.
Okay. So at the end of every workout, it's really important to make sure that we stretch. So I'm going to show you a couple of stretches today for muscle groups that we use during the workout. So the first one will be the hamstring. So I'm going to just get you to lie down on your back for me, please. So you can do this yourself, or you can have someone help if you want a little bit more tension placed on the muscle. So if you can just raise your leg and keep your knee straight, don't bend it, and you just lift it back, you should be able to feel the tension in your hamstring. Okay, so by me doing this, I'm just putting a little bit more pressure on that. If you were to do it yourself, you just lift it up until you can feel it. You can actually put your hand behind your knee, try and put your leg up a little bit higher. Okay, so you should hold every stretch for 30 seconds. And then move to the other leg. Another hamstring stretch is obviously you just want to bend down and touch your toes.
Like that?
Yeah, or you can do it standing up. You might feel a little bit more tension standing up. Okay, you feel that in the back of your hamstring. And then the last one that I'll show you, you can get down on one knee and just point your toe up and lean forward, and you'll feel that in the back of your hamstring as well. So you should do that one for 30 seconds and then alternate to the other leg as well. With your stretches, you should just don't do one stretch for 30 seconds, do 2 or 3, but you don't want to hold it for too long. So 30 seconds, release, stretch your other leg, come back and do another 30 seconds. Fantastic.
Thank you.
The stretch that I'm going to show you is for your quadratus lumborum. Now, most people would know where that muscle is. It actually runs from your rib cage down your side into your hip. So you'll find that most people that have lower back pain, this will be part of the reason. So it's fairly simple. You lay down on the floor on your back, knees up, arms out, and you're just going to bring your knees over to the side. Try and keep your shoulders flat to the floor. Bring it back. Cross over again. And hold it there. Once you've held it there for 30 seconds, just bring it back over. There's another variation where you can swing one leg over and hold it there. So I'll get you to have a go at that. Just raise the knees up, just roll them over this side.
That's good on that side.
So you can feel that through the lower back on the side. Very good.
Good. Thank you.
Welcome. Thank you.
Thanks.
About special population modifications to training programs, and first of all, training someone with hypertension. You want to really be conscious of movements that have their feet above their head, which will increase the blood pressure on the heart and can cause issues. Also, you want to make sure that there's no lifting of weights over their head, which would have an excessive blood response to the heart as well and cause issues. Another thing you want to be conscious of is that the client is breathing through every rep and through their exercises in order to prevent an excessive blood response as well. Exercising is great for lowering blood pressure, but you want to make sure that prior to beginning any exercise program with a client that you have got them to consult their doctor and follow the recommendations from the doctor before putting any client through any sort of weight program or cardio program. Another special population modification is for clients with lower back pain. Exercise can strengthen the back, stomach and legs, which helps support the spine and alleviate back pain. Obviously, before undertaking any program for a client with lower back pain, you want to make sure that they've consulted their doctor and follow the recommendations prescribed by the doctor for the training. Some exercises to avoid: deadlifts, obviously placing pressure on the lower back; leg lifts, toe touches if they're standing there, bending down to touch their toes; full sit-ups, which place a lot of pressure on the lower back; and obviously weighted squats. Some exercises that you might want to try to prevent issues with the lower back are partial crunches, which will strengthen the back and stomach muscles; wall sits, back extensions, bird dogs, hip raises, and obviously some weights depending on which form of weights you want to prescribe for your client. But once again, make sure that they've consulted their doctor, the doctor's okay for them to undertake an exercise program, and you follow the recommendations of the doctor 100%. Special population modification that I want to talk about today is training clients with shoulder injuries. Now, one thing that you want to do is obviously seek medical approval for a client to be training first, but once that's been done, you want to avoid any movements that will impinge on the shoulder joint and muscles surrounding the shoulder joint. So lat pull downs will be one thing that you would not want the client to be doing, and also if they were doing a dumbbell bench press, the movement where if it was too deep, having the arm not parallel to the floor going past that, which would also place undue stress on the shoulder joint. Some things that you could look at doing would be partial upright rows, not having the movement come too high up, which would place pressure on the shoulder joint. Maybe front raises with a plate, which means that both shoulders are working together at the same time. If you were using a dumbbell, it could put pressure on the injured shoulder. And then also some lateral raises with dumbbells, which would help build the strength around those muscles, but not going too high. So obviously seek approval from a doctor first, and once that's done, then help build the client's strength around the shoulder area, and if and when that's done, progress to further weights training.